The National Institute of Health has now launched a federally funded study to learn how COVID-19 is impacting children.
Right, good to hear, of course. And this is something that so many of us parents are worried about. So we want to bring in Dr. Kristen Moffatt with Boston Children's Hospital, talk about this, talk about so much more. Dr. Moffatt, thank you for being here. In places like New York, the number of kids with these symptoms, is it growing? Are we seeing this here in Massachusetts? What do we know?
Yeah, so the largest spikes in these cases have been reported so far in New York, particularly from New York City, and as well in the UK, particularly out of London. And that has included a spike beyond what we would typically see for these numbers of Kawasaki-like disease or pediatric inflammatory disease. We are not yet seeing a spike like this in Massachusetts, but it is incredibly helpful that these reports have been disseminated so broadly because pediatricians are very much on the lookout for these symptoms.
And this is rare, we should point out, this complication, but are there any early indicators that parents should be looking for?
Sure. Yeah. So I would reiterate what you said. It should be people should remember that this is still a very rare presentation, and the signs or symptoms that parents should be on the lookout for would be fever that is not just a one-time fever that goes away and is otherwise unexplained, but fever that really persists, or fever that may be associated with development of a rash, or development of redness of the eyes, or redness of the lips, or inside the mouth. Additionally, sometimes children are presenting with fever and really severe abdominal pain that may be associated with vomiting as well. So any symptoms like that should be discussed with your doctor.
Okay, good advice. So let's talk a little bit about reopening. We know it's happening in the next couple of weeks or so. Some places are already doing it. What is the process and what questions should you ask yourself and your family when you think about reducing social distancing with extended families, say people like grandparents who haven't been able to touch their grandchildren in months?
Yeah, no, that's a really good question, and so many families will be grappling with decisions like this in the weeks to come. I think what should be remembered, though, is that it's really not entirely known yet what will happen in terms of community-wide transmission as we begin to reopen. And it may take some number of weeks in these stages of reopening to really understand whether or not cases are increasing in the setting of reopening. So I think families should really still proceed with caution.
Okay.
I think they should think about whether any of the people who they want to be with or spend time with or be near might have underlying risk factors that could make them more vulnerable to severe disease, and still, until we have more information, still continue to practice care.
Yeah, stay the course. All right, so I have a question about this one. A lot of kids, mine included, have had way more screen time recently than ever before, really because of remote schooling, which is good. But is there a downside to all of the reliance on the tablets and the computers as they do that work?
Yeah, we're struggling with this in my house as well, as so many families are. And I think it really just has to be taken on balance. Children really are relying on screen time, as you said, not just for online schooling and staying in touch with their classmates and their teachers, but they're relying on enhanced screen time to stay in touch with their peers and feel like they're not isolated from their friends too. So if they can do that on balance still with spending time off of screens with their family and their household members, getting exercise, getting outside when it's safe to do so, I think all of that needs to be taken on balance.
Finding that balance, which can be hard sometimes. All right, but that's the goal to work toward. Okay, Dr. Kristen Moffatt, thank you so much for being with us. We appreciate it.
Sure, thanks for having me.